My name is Victoria Incia. This presentation was prepared as part of the HAP 709 Healthcare Databases Summer 2019 course taught by Professor Coffin at George Mason University's Department of Health Administration and Policy. We all know someone who has been diagnosed with diabetes. That is how prevalent the disease is. In the United States alone, 30.3 million Americans, or about 10% of the total population, has diabetes. Additionally, about 1.5 million Americans are diagnosed with diabetes every year. It is also the seventh leading cause of death. Early detection is key when it comes to any disease, including diabetes, because it can help keep diabetic patients healthy and thereby reduce any serious further complications. The remaining slides will discuss a sample SQL model for diabetes screening. I used simulated data from a major health institution in the United States with approximately 17 million records and 830,000 unique patients. In order to define diabetes, I use clinical classification software codes, also known as CCS codes. CCS codes provide a list of codes for a multitude of diagnoses. In this case, as you can see below, I use the CCS code specific to diabetes. I used a comprehensive set of diagnoses to predict diabetes or the risk for it. This slide provides a sneak peek into sample code that was used throughout this model. I have circled two important things that added to the list of predictors. The first is age. As you can see here, we chose patients older than 40 years old. Secondly, as you can see here, we chose diagnoses which had at least 29 observations. This ended up being around 5,200 diagnoses. On this slide, you can see a subset of obvious predictors. These are diagnoses that always occur with diabetes or may contain the word diabetes in them. They were not used as part of the SQL model to define diabetes. Next, I have listed out 10 examples of rare diseases that are predictive of diabetes because they occur more than 29 times, but they occur less than other diagnoses that were considered. This includes diagnoses such as severe atrophy of the jawbone. Using the likelihood ratio calculation, I have outlined a list of 10 most predictive diagnoses that are not necessarily obvious. These diagnoses had high likelihood ratios. This includes hyperlipidemia and coronary sclerosis. I use the naive Bayes methodology to aggregate data from individual diagnoses to calculate overall probability for diabetes. The naive Bayes method is fast and pretty straightforward to execute in SQL Server. On the next slide, I'll talk about the sample code that was used throughout this model. Here, you can see an example of how naive Bayes was used for this model to calculate odds and probability. You can see here, I have listed out 5 diagnoses and their corresponding odds and probability. So at this point, I have been able to build a model based on predictors that I have outlined in the earlier slides. However, I still need to check how valid my model is, and that is where cross-validation comes into play. In this model, I set aside 80% of the data and put it into the training table, then set aside 20% of the data and put it in the validation table to validate the model and check how accurate my predictions were. I used the receiver operating curve to cross-validate the accuracy of my predictions. ROC curves plot the true positive rate against the false positive rate. The closer the area under the curve is to 1, the better. The area for this model was approximately 0.91. Diabetes screening is important because, simply put, it could save lives. If diabetes can be detected early, it can lead to lifestyle changes for the patient. and prevent further progression to diabetes and its complications. This is why early detection is so important, and we can leverage predictive models in the process.